Go ahead.
Very good evening, everyone. I'm Dr. Jalagam Kavya Rao, Clinical Head and Fertility Specialist, Oasis Fertility, Warangal. So, a very warm welcome to all viewers for today's session. This week, importance is we are celebrating National Infertility Awareness Week. So, this is celebrated in every month of April. April month, the last week is celebrated in view of bringing awareness for infertile patients by giving them information. Provide right information at right time will help you to uh, become a mother or a father for the childless couples. So today's topic, one of the common topic for today is like, is there any hope after IVF failure? So this is very common question. So today నేను ఇవాళ మీకు నెక్స్ట్ మొత్తం మన లైవ్ సెషన్ లో మీకు ఇచ్చే డీటెయిల్స్ ఐ థింక్ ఇట్ విల్ బి యూస్ఫుల్ ఫర్ యూ బిఫోర్ you start any treatment. And once, even if the IVF is failure, there is always a hope how to come back out of it. So first thing, what is IVF and ICSI? We all know. And the indications for IVF and ICSI, both male and female partners, there are different indications why your clinicians will advise your IVF. So looking into the male indications, the most common indication is low sperm count and low motility. And the most common thing is azoospermia, where the patients come to us with the reports of no sperm counts or very low sperm counts, even after giving a medical treatment for 3 to 6 months. Also, if there is no improvement in the sperm counts, then we will advise them IVF. Coming to the female partner indications, the primary indications are tubal blocks. So when your tubes are blocked, both unilateral or bilateral block, number one, when there is no scope for us to allow you to go for a tubal opening surgeries, or unblock your tubes when there is no chance, or when you have a PCOD problem, when you have an irregular periods, and when there is no ovulation happening on a regular basis, requiring multiple visits to hospitals, or if you're resistant PCO in spite of trying for various drugs and injections also, if you're not able to develop a follicle, then the patients might need an IVF treatment. The other main indication is your age. Always the female partner age is very important, because IVF success or failure is dependent on that. Now in today's discussion, I'm going to discuss top 5 to 6 reasons why your IVF can be a failure thing. Number one, a female age. So female age when less than 35 years is where the success rates are very good, nearly 50%. But once your age is crossing above 35, what happens to your ovaries is your ovaries will also grow old like us. So there, then the number of reserve or the number of eggs in our ovaries can decrease each bi-monthly, or every 6 months there might be a decreasing pattern of the number of eggs. So how can we detect, and what is the chance for them is, the first thing where we look to identify the patients with low ovarian reserve is by looking on the ultrasound scan. So before starting any IVF stimulation, check yourself how many antral follicles were you told before starting the stimulation, number one. Number two, we should correlate with the hormones like anti-Mullerian hormones and FSH hormone, which are the basic important things which will give us some information about the chances or success for us to for during the stimulation. So what happens here is the number of injections you are requiring, the number of days of stimulation you are requiring will also matter. So keep checking yourself how you are responding to the drugs, the dose of drugs and the duration which you are requiring is very important. So after the dosage of the drugs, finally the most important step for any IVF treatment is the egg collection. The number of oocytes retrieved is very important, and the number of oocytes retrieved will directly, it affects your success rates, because the more number of oocytes collected will give you the more number of embryos. And finally, the The most important thing is the IVF lab unit also, because the embryos are growing in the lab. So you have to check whether the IVF unit is having a proper lab by 24-hour embryologist coverage, because that is very important. And the lab internal environment is very important, like oxygen, carbon dioxide, the pH and everything, because a minor change in this parameters can influence the embryo growth. So that is very important. And the most important thing after the egg collection, what are the factors which will affect your success is, first thing is the oocyte quality. So if the oocyte quality is poor or not up to the mark, so there comes the discussion whether to proceed with ICSI or IVF. Second thing is the sperm count and motility. How is the sperm sample collected by the male partner or the husband on the same day? That is very important. And the other most important thing is, how do we choose the sperms for the ICSI? So sperm selection methods, there are various ways how to we select the sperm selection. First thing is the double density gradient, which we do for general all patients, because the double density gives us the a good layer of sperms which are healthy, fast and motile. The next important thing is, it's not only about the sperm count and motility, we need to check the internal DNA healthiness of the sperm. So there are many other parameters by which we can select that. Example, one of the most popular method for sperm selection is microfluidics or max, which we are doing in our centers. So with which we can select the best DNA sperms. So the best DNA sperm, when it is mixed with the egg, there comes the best embryo. So the egg quality, sperm quality is very important. If the quality of the egg and sperm is good, finally we will get a good embryo. Now, so for the embryo to grow in the lab, as I discussed a few minutes back, it is very important about the culture systems, about the equipment or the environment of the lab for the embryo to grow. Now, if we look into the embryo growth, the first step that happens in the lab is the fertilization. So fertilization is the first step where the gametes are together and they accepted themselves to grow. That is the first sign. And now, when to go for the embryo transfer? So embryo transfer will be discussed before with the couple, even before the trigger, whether to go for a frozen embryo transfer or a fresh embryo transfer. So for all the women who are able to produce only like 6 to 8 number of oocytes, they are the ideal candidates for fresh embryo transfer, because the hormonal fluctuations in their bodies will be less compared to the women who are producing more number of oocytes during the IVF stimulation. For these reasons, the fresh embryo transfer is reserved to the patients for poor responders. So these people can go for a fresh embryo transfer in the same cycle. So now, when to go for the embryo transfer, whether it is a day 5 or a day 3. So many centers will have a various protocols according to the institutional SOPs. So usually the best method to go for the embryo transfer is always a blastocyst, because blastocyst quality is very good compared to the cleavage stage. And finally, if the embryo is able to grow till the blastocyst in the lab, we will be able to decide the grading. We will be able to see the grade of the embryo, and with the grade of the blastocyst we can decide the pregnancy chances for that particular couple. If in case, if you are choosing for a cleavage stage embryo transfer, the only drawback is we don't know when the embryo will be able to uterus. If the patient is not able to conceive, we will be not able to understand whether it's an embryo fault or an endometrium fault. So for these reasons, we encourage all of our patients to go for a blastocyst transfer. So what is blastocyst transfer is, on day 5 after egg collection, the embryos will be looked for. The embryos will be looked for various parameters. Example, in a blastocyst, we look for a trophectoderm outer layer, we look for the inner cell mass, we look for the blastocell expansion, and we grade the embryos into grade 1, grade 2, and grade 3. So different grade of embryos can be chosen by the patient, and the number of embryos also can be chosen by the patient. So first, if the IVF failure has happened with a C grade blastocyst, what do you think? So whether the pregnancy chances are good for all grades of blastocyst? No. It's always a good blastocyst. Grade A will have a better success rates like 50%. Grade B can have 40%, and grade C can have 30%. So when you have a failed embryo transfer, with a blastocyst or a grade 1 blastocyst, then you should be thinking more about the uterine internal environment. Second thing is, when you have a failure with a C grade blastocyst, if the embryo regions are of poor quality, in most of the cases, embryos, it can it can have an implantation rate of up to 30%. So in these particular cases, the patient might have to be repeated for an IVF stimulation if they don't have any embryo left with. So first thing, a good quality embryo transfer, if it is failed, we will look for the uterine environment, and also we will look for the window of implantation timing, that is endometrial receptivity test. Second most important thing is, a good grade blastocyst, if fails to implant, we will look for the genetic makeup of the embryo, that is pre-genetic testing for the embryo, if it is done or not, by which we can select the normal euploid embryo. If the patient, if still having a failure with the pre-genetically tested embryo and an endometrial receptivity timing is used or applied for the embryo transfer, there are various reasons why it can happen, it can be a failure. One of the most important thing is the immune mechanism or immune system of the lady should be checked for, and the immune system mechanisms have to be corrected before they go for one more attempt. So the most important thing here is, as I have discussed, during IVF stimulation, make sure that the eggs are growing good, and during the collection, check whether you have got the adequate number of oocytes. Finally, a good grade embryo, which is mostly preferable blastocyst. And finally, the embryo transfer technique is also very important, because a good embryo transfer technique and embryo transfer preparation is also very important, because the endometrium is the place where the embryo will grow in the uterus. How do we prepare the endometrium? Is by various methods. One is the natural cycle endometrium preparation method, the other is the artificial cycle preparation method. So which one is better? Many patients will ask me, do we need to take so many tablets and medications and injections for the embryo transfer? Most of the cases it is yes, because we need to match the patient requirement accordingly, because if a patient is not able to come for regular visits and she is not compliant with the tablets or injections, we will go for a natural cycle endometrium preparation, where she will naturally develop a follicle, and from the follicle there will be an estrogen which is released, and from which the endometrium is developed. Whereas in artificial preparation, we will downregulate the ovaries, where her ovulation will be stopped temporarily, and then the embryo transfer preparation will be done with an exogenous support of the estrogen. That is, we give the tablets in oral forms, vaginal forms, or a transdermal forms for local applications. And then once the endometrium is reached up to 8 to 9 mm, maximum 9 mm, 9 to 10 mm, which is a very triple line good pattern endometrium, there we start the progesterone. And the route of progesterone can be oral or vaginal or injection form. So various hospitals prefer various protocols. The most important route is what we prefer is the intramuscular route of progesterone, which will be there for 14 days till the beta HCG. So during the preparation for embryo transfer, it is very important for you to check yourself how healthy you are and how comfortable you are during the process. Any reports of stomach pain, that is suprapubic pain for you, or any fever episodes or any discomfort should be reported to your doctor. If there is no significant issues noted during the embryo transfer period, most of the cases the procedure will be successful. But in some cases, like if we have a recurrent implantation failure patient, then there comes the role of laser assisted hatching, where we will allow the embryo to go through the laser process. What happens in the laser assisted hatching is, we will just drill the outside layer of the embryo, so that the embryo can attach itself into the endometrium easily once it is placed back into the uterus. So this is laser assisted hatching. So these are the various parameters by which we are understanding how IVF is done. But unfortunately, in few cases, that is 20 to 30% of the cases, we don't know why the embryo transfers are being failure. But we at Oasis are offering various technology and techniques to support all the recurrent implantation failure cases, and we have a very special unit which is implantation failure unit, which will be available in all our Oasis branches. So I request all the people to use the facilities available for all patients who are in need for IVF. So always there is a hope for second time also. So sometimes patients ask me that, is it only after second embryo transfer the chances will be more? So it is not like that, because when all the parameters are taken care, usually 50 to 60% patients conceive in the first attempt. The second timers are only few, where we need to look for the genetic status of the embryo and also the timing, and sometimes maybe we need to repeat a hysteroscopy also to look for the internal environment of the uterus. So this National Infertility Awareness Week, I just want you to understand about IVF and IVF failure issues. And if anyone is looking for any treatment, you can please reach me out to the below scrolling numbers and write down any email or queries to me. Thank you so much.